Welcome back to FCC Knows Mental Health. Hello, and welcome back to FCC Knows Mental Health. In today's video, we will be discussing Self-Harm Awareness Day and Self-Harm Awareness Month, and we'll be going over an activity that you can do or provide for someone else who may be experiencing or dealing with self-harm. Self-Harm Awareness Day or Self-Injury Awareness Day is held on March 1st of every year and is an international event that is recognized all across the globe. The entire month of March is recognized as Self-Injury Awareness Month. Self-harm can be difficult to understand, and due to this, many people react in a negative or judgmental way. Raising awareness about self-harm is incredibly important as it leads to community understanding and empathy, banishing stigma and judgment, and reducing the number of people who may suffer in silence. In the current times we are living in, with isolation and depression, anxiety at an all-time high due to COVID-19, it is critical to understand why people may turn to self-harm and what to do if a loved one reaches out for help.
So what is self-harm? Self-harm or self-injury means hurting yourself on purpose. One common method is cutting with a sharp object, but anytime someone deliberately hurts themselves is classified as self-harm. So some people feel an impulse to cause burns, pull out hair, pick at wounds to prevent healing. Extreme injuries can result in broken bones. Hurting yourself or thinking about hurting yourself is a sign of emotional distress. These uncomfortable emotions may grow more intense if a person continues to use self-harm as a coping mechanism. Learning other ways to tolerate the mental pain will make you stronger in the long term. Self-harm also causes feelings of shame. The scars caused by frequent cutting or burning can be permanent. Drinking alcohol or doing drugs while hurting yourself increases the risk of a more severe injury than intended, and it takes time and energy away from other things you value. Skipping classes to change bandages, or skipping work, or avoiding social occasions to prevent people from seeing scars is a sign that your habit is negatively affecting work and relationships. So why do people self-harm? Self-harm is not a mental illness, but a behavior that indicates a need for better coping skills. Several illnesses are associated with it, including borderline personality disorder, depression, eating disorders, anxiety, or post-traumatic distress disorder. Self-harm also occurs most often during the teenage years and young adult years, though it can happen later in life as well. Those at most risk are people who've experienced trauma, neglect, or abuse. For instance, if a person grew up in an unstable family, it might have become a coping mechanism. If a person binge drinks or uses illicit drugs, they are at greater risk of self-injury because alcohol and drugs lower self-control. The urge to hurt yourself may start with overwhelming anger, frustration, or pain. When a person is not sure how to deal with emotions or learned as a child to hide emotions, self-harm may feel like a release. Sometimes injuring yourself stimulates the body's endorphins or pain-killing hormones, thus raising their mood. Or if a person doesn't feel many emotions, they might cause themselves pain in order to feel something real to replace emotional numbness. Once a person injures themselves, they may experience shame and guilt. If the shame leads to intense feelings, that person may hurt themselves again. The behavior can thus become a dangerous cycle and a long-time habit. Some people even create rituals around it. Self-harm isn't the same as attempting suicide. However, it is a common symptom of emotional pain that should be taken seriously. If someone is hurting themselves, they may be at an increased risk of feeling suicidal. It is important to find treatment for the underlying emotions. How common is self-harm? Despite the seemingly fringe aspect of this condition, it is much more common than most people realize. Among teenagers, an estimated 15% will experience some form of self-injury. The number drops to 4% among adults. The most common forms of self-harm include skin cutting, which is 70% to 90% of self-harm, head banging or hitting 21% to 44%, flesh burning 15% to 35%. Perhaps one reason for the lack of awareness around the condition of self-harm is that a person can easily hide or explain away their injury. What are the signs of self-injury? For family and friends, especially those who have loved ones suffering some type of mental illness, it's important to watch for signs and patterns of self-injury. These might include arms, legs, or other parts of the body that show signs of consistent injury, such as scabs, bruises, burns, and cuts. Another sign is overdressing in particularly warm weather, wearing, for example, coats, long-sleeve shirts, or pants when the weather is warm to hide signs of injury. Another sign, repeatedly making excuses for why or how they got injured. Another sign would be avoidance, isolation, or withdrawal from activities and relationships they previously enjoyed. The overwhelming majority of self-injury cases, some up to 90%, begin in adolescence. While the condition brings temporary relief for a person suffering, it carries a lot of shame and stigma.
Hey everyone! Today we're going to be creating a self-harm safety box. Now this can be especially helpful for when you're having some self-harm ideation or when you're maybe just feeling a little bit overwhelmed. And so step one of creating your box, you'll just need any old shoe box or any box from the craft store. And I want you to decorate it, personalize it, because it is yours. And now today I just have an example here of a little storage box that we've got. I'm going to open it on up and show you a couple examples of some things that you might want to put in your own box. But of course, make it unique to you and how you best cope when you're feeling those feelings or having those thoughts. So of course, a very important aspect of your self-harm safety box would be to have a safety plan. Now it doesn't necessarily have to be a template online, but it's really great to always have some contact numbers of social support, people who you trust and who could be there for you to talk to, and so you know that you're not alone during this time. So when you fill your box, you might want to fill it with some things that make you feel happy, some things that help to trigger your senses, and some things to help find a healthy distraction from maybe wanting to self-harm in that moment. And making sure that you try to avoid putting things in your box that could do you harm. So you want to kind of stay away from those things. So I have a little plush bear, and so this, as far as the sensory, is soft and squishy, and you can hold it and comfort yourself there. So I've got some beads and some buttons in here, and this can be really nice. You can add some string, maybe make yourself some jewelry, or just, you know, feel the sensation of those beads. And that can really help to kind of satisfy that touch and those sensory things that we have when we're thinking about self-harming. Of course, had to include a stress ball. It can be really nice to kind of relieve some of that pressure in a healthy way. And sometimes it might be helpful to have something that smells good. So some essential oils or a candle. We have some glitter glue, so if you wanted to put a canvas or some paper in and just squeeze that glue out, you could even squeeze it onto your hand and play with it in your hand, and that could be a really nice way to kind of distract and still tap into that sensory there. We have some Play-Doh, kind of self-explanatory. You can create things, or you can just squish it in your hand. Even kind of smelling that Play-Doh a little bit and just taking in the sensations can be a really healthy distraction for you. We've included some crayons and some colored pencils and some note cards to maybe even write down some thoughts that you might be having. Sometimes just getting them out of your head and onto some paper can help you see, okay, I'm feeling badly in this moment, but this moment will pass. And we've also included some Suicide Prevention Lifeline contacts, and this can be helpful to have if you find that your thoughts are getting overwhelming and you'd like to speak to a professional. We have some rubber bands in here, and now just as a disclaimer and a warning, for some people they find that playing with a rubber band can be triggering, but for some people it can be helpful to have that sensation there. And just some little other things in there, just some things to distract and kind of bring those sensory pieces in as well. We had included some bubbles. Blowing bubbles can be very therapeutic and a nice way to kind of take your mind off of, just seeing so much tunnel vision in that moment. And then I included some cards here, just some motivational quotes if you find yourself having maybe some irrational thoughts or some darker thoughts. And just reading these out loud can be really helpful. This one says, "I'm not alone in my struggles," as you are not alone. This one says, "It's okay to be kind to yourself." That's a big one. And it's also okay to admit, hey, I'm struggling right now, and that's okay. You are doing your best. Sometimes the pressures of life and expectations from those around us can make us forget that no one asks us to be perfect. They just ask you to be authentically you. And difficult roads often lead to beautiful destinations. So there's so many ups and downs in life, but there is most often a very beautiful destination, which is healing and self-awareness and overcoming, of our obstacles there. So having a self-care box can be really great when you find yourself struggling. And I would encourage you to keep it in a place that's private and safe, someplace where you know that it will be there for you when you're having those triggering moments. So I hope this helps someone.
Treatment and coping. There are effective treatments for self-harm that can allow a person to feel in control again. Psychotherapy is important to any treatment plan. Self-harm may feel necessary to manage emotions, so a person will need to learn new coping mechanisms. The first step in getting help is talking to a trusted adult, friend, or medical professional who is familiar with the subject, ideally a psychiatrist. A psychiatrist will ask the person questions about their health, life history, and injurious behaviors in the past and present. This conversation, called a diagnostic interview, may last an hour or more. Doctors can't use blood tests or physical exams to diagnose mental illness, so they rely on detailed information from the individual. The more information that person can give, the better the treatment plan will be. Depending on any underlying illness, a doctor may prescribe medication to help with difficult emotions. For someone with depression, for instance, an antidepressant may lessen harmful urges. A doctor will also recommend therapy to help a person learn new behaviors if self-injury has become a habit. Several different kinds of therapy can help depending on the diagnosis. Psychodynamic therapy, which focuses on exploring past experiences and emotions. Cognitive behavioral therapy focuses on recognizing negative thought patterns and increasing coping skills. Dialectical behavioral therapy can help a person learn positive coping methods. If your symptoms are overwhelming or severe, your doctor may recommend a short stay in a psychiatric hospital. A hospital offers a safe environment where you can focus your energy on your treatment. What to do when someone self-harms, or things you can do to help someone who may be in a crisis or experiencing some self-harming tendencies or behaviors. How you react if someone discloses their self-harm is extremely important. The news may distress you and you may feel overwhelmed with emotions. You may feel confused, frustrated, guilty, or sad. All of these emotions plus so many more are not only valid but common. Here are some tips to help deal, or things you can do to help deal with someone who may be experiencing self-harm tendencies. 1. Don't panic. Learning that someone you know or love has been or is currently self-harming can be a shock. Try not to panic or expect to be able to fix all their problems. Sometimes just being there and providing a safe and non-judgmental space is enough. 2. Listen. Allow the person to speak without interruption or judgment. For a lot of individuals who self-harm, self-harming is the only way they know how to express emotion. So for someone to open up to you about their self-harming behaviors is a huge breakthrough. 3. Help them find support. Offer to help the individual find support in the area if they are open to it. Finding support options can be overwhelming for them, and your assistance may just be what they need. 4. Be there for the long haul. Don't expect a quick fix. Some people self-harm for years as a way of dealing with difficult emotions or situations. Most people don't want to be defined by their self-harm, so keep on being a friend to them as normal too. 5. Look at yourself. It's important to look after yourself when helping a loved one who is self-harming. Recognizing the need to set boundaries on what you can offer and getting help for yourself is important. If you or someone you know is struggling with self-harm, you can text the Self-Harm Crisis Hotline at 741-741 or call 1-800-273-TALK or 8255. Scars tell the story of where you've been. They don't dictate where you're going. In efforts to promote awareness, here are some additional resources. Well, that is all that we have for you today on this episode of FCC Knows Mental Health. We'll hope to see you next time. Thank you for watching.